People wait in cars outside the new Roseland Hospital on Chicago's far south side. The lines have been getting longer in the last few days.
Come on in, you're here for testing? Yes. Come on in.
Inside, the hospital is already struggling to cope with a surge in positive COVID-19 cases. This is the makeshift COVID-19 ward.
All of the patients on this particular unit are positive for COVID. However, if they need to be on a ventilator, we have to transfer them to ICU.
Hi.
MARIANNE Gray is a nurse manager on the COVID-19 ward. How full is it now, again, with COVID patients?
This ward is at capacity.
My appetite hasn't been that good.
Brian Taylor was brought into the COVID-19 ward just a few days prior to our visit.
I got a little worried at first, but they've been taking care of me, and I have a lot of people praying for me. And just be careful, it's scary.
One floor up is the hospital's intensive care unit. A COVID-19 patient fights for his life. He's been reliant on a ventilator for days. I meet Anthony Curry, a patient in the ICU.
From what I've been seeing what's been going on up here, and there's a lot of people not making it, and everything is getting crowded. Everybody need to take this serious and social distance and wear your mask.
This hospital's 10-bed intensive care unit is once again filling up with COVID-19 patients. But an added strain for the hospital this time round is that many of the staff are also getting sick with the virus. Tim Egan is the hospital's president and CEO.
Well, I believe we're in a disaster right now. A lot of our employees who suffered through COVID have come back and gotten back on the front lines, but we've lost another big percentage of COVID positives who have not been able to return to work.
COVID's impact on staffing is an added pressure to the hospital's already strained ability to respond to the virus.
I'm actually afraid that we're going to get overrun by the sheer volume and the intensity of the sickness of the patients. I'm concerned about that. That's what keeps me awake all night. What do we do when we get to the point where our ICU is full and the ER is packed?
Dr. Victoria Brander was brought in by the hospital to help with their efforts to combat the pandemic.
I'm afraid we don't even have the post-mortem abilities, like, the abilities to care for our dead properly and safely with what we're looking at in the next month. This is an existential threat to our civilization and our country.
It'll be 10 minutes, it'll be 15 minutes.
Back at the testing site, the medical staff continue the testing program. This is a hospital at the sharp end of the surge in COVID-19 cases. The next few weeks and months promises a challenge like no other. Dan Williams, CGTN, Chicago.